This video will show the steps to safely don and doff PPE for airborne respirator contact precautions. Signs like these should be posted in donning and doffing zones near patient care areas. Reference these signs with your trained observer when donning and doffing your PPE. Prior to entering the patient room, remove your badge and any other personal belongings from your pockets. You should only enter the room wearing your scrub top and pants. No jackets or exposed t-shirts. Jewelry should be minimal. It's best not to wear rings or anything other than stud earrings. Your hair should be pulled back away from your face. If you wear glasses, make sure they're secure. Ensure your scrub pants are not dragging on the ground, and make sure that you have a plan with your trained observer for your exit. When donning and doffing your PPE, you'll work with a trained observer. The trained observer's purpose is to ensure that you're following the proper donning and doffing steps to prevent contamination. There are two types of PAPR hoods. The standard hood comes in sizes small and large. To fit, adjust the gray headband to sit on your forehead. The elastic around the chin and face should be snug without any gaps. The shroud is commonly used in settings where it's important to maintain a sterile field, like the operating room. The shroud should be worn under an isolation gown and comes in sizes small and large. Prior to use, perform a machine check of your PAPR device. Press the test button on the battery to ensure a full charge. Attach the battery to the machine and turn on. To perform an airflow test, attach the airflow meter. Ensure the ball blows over the line. After this is complete, perform an obstruction test by covering the airflow port. This may take a few moments, but you want to hear an alarm sound letting you know the machine will alert you when there's an airflow obstruction or your battery is low. The hose attaches to the machine by lining up the silver prong end to the air port and twisting. The other end will attach to the PAPR hood. Gently push it in and you'll hear a click. To don your PAPR, begin by performing hand hygiene. Fit your PAPR hood, ensuring a comfortable but snug fit, with no gaps around your chin and face. It's important to inspect the hood for cracks or tears. If found, the PAPR should be discarded. Next, fit the PAPR machine around your waist. Again, you want to achieve a snug but comfortable fit, so adjust if necessary. Tuck the belt to prevent it from dragging on the ground. Your trained observer will help to attach the hose to the machine, and then the hose to the PAPR hood. For comfort, turn the machine on prior to donning the hood. Next, you'll don your isolation gown. Be careful when placing it on over your PAPR hood to not stretch out the neckline. To secure the gown, tie it in the back. You'll don your gloves, making sure to completely cover your wrists. Your trained observer will do one final inspection of your PPE prior to you entering the room. When you're ready to exit the room, call out for your trained observer. With clean gloves on, use a sani wipe to wipe down the door handle. The trained observer will also do this for the outside door handle. Perform hand hygiene over your gloves, and while facing the patient, carefully remove your gown by pulling at the waist first, and then the shoulders. Roll your gown inside out, and remove your gloves with your gown. Perform hand hygiene, and exit into the doffing zone, where you'll meet your trained observer. You'll meet your trained observer in the doffing zone directly outside the door. The trained observer will be donned in droplet contact precautions to assist with your doffing. After performing hand hygiene, your trained observer will hand you a clean pair of gloves, then a sani wipe to disinfect your PAPR belt. Your trained observer will begin to disinfect your PAPR hood with sani wipes, wiping back to front and ensuring that disinfectant stays wet. This may require multiple wipes, but for purposes of this video, the trained observer is using a single wipe. Again, a reminder, back to front, ensuring the disinfectant stays wet. After disinfecting the PAPR hood, the trained observer will disconnect the hose from the hood and turn the machine off. Remove the PAPR hood by pulling up and away, being very careful not to touch your face. Hang on to the PAPR hood as the trained observer disinfects the PAPR hose, then the machine, again ensuring the disinfectant stays wet. When complete, the trained observer will hold onto the PAPR machine as you unclasp the belt. The trained observer will place the PAPR machine in a designated used PAPR bin to dry for at least 2 minutes. If reusing your PAPR hood, your trained observer will perform hand hygiene and don a new pair of gloves to disinfect the front of the PAPR hood. Hang the PAPR hood on an IV pole to dry for reuse. You may now doff your gloves, perform hand hygiene, and leave the doffing zone. The trained observer will now doff her PPE in the doffing zone by carefully pulling at the waist, then the shoulders, rolling the gown inside out, and removing her gloves. Finish with hand hygiene and carefully remove the face shield onto a clean paper towel for reuse. Perform hand hygiene and exit the doffing zone. For more information, please visit the Harborview Infection Prevention and Control page on the intranet.